My name is Hunter. I'm currently living in Stoughton, Wisconsin with my parents, and I am 22 years old, going on 23 soon. I started seeing my primary care doctor around the age of 16 to 18 after an introduction by my dad and everything, and ever since then we've just really clicked, and me and my doc are relatively good at understanding what I need, and when I ask him specific questions, he does his best to answer them in a way that I can properly understand them. He doesn't confuse me. He tries to respect my personal boundaries when asking questions, and I respect his professional boundaries as a doctor. It's, as I said, a two-way street for respect and loyalty. I really do love my doctor. He's funny. The nurses he works alongside as well does the same thing. They are all really respectful people to personal boundaries. Their patients and myself included possibly all really like them because of that. It was a hard road to get me independently to create my own appointments and everything. In the beginning, it was primarily me making the call and then my dad doing the rest, but over time we slowly built up the bridge is needed for me to do it independently. And then we discovered the most God-sent technology called MyChart. And ever since then, I've been doing it independently. And the first time I actually fully did a independent appointment was with my dietitian, a nutritionist and everything. And my parents, I just dropped the bomb on that on my parents, and they were wondering why. And I simply told them I talked to my primary care doctor. I asked how can I help gain weight healthily and everything, and he recommended a nutritionist. So I set up an appointment without any input from my parents. And ever since then I've been trying my best to do so. And MyChart really does help get you in touch with your primary care doctor and other doctors you have need of. It really was a godsend when we discovered it. The hardest thing for me to make my own appointments was keeping track of time and to make sure that I scheduled it properly within the time frame required to set them up, and also making sure I get there on time. I've never really been good with time management, but thankfully with MyChart and my cell phone, I've been able to do so. Also, GPS helps a lot in making sure to avoid major traffic areas. So there are two tools that I definitely recommend people to get: MyChart and a GPS that works. I primarily do self-talk in the waiting room about what questions I can ask and what questions that they can ask to prepare myself to answer. I primarily in the car listen to my radio, so if a good song comes on, I lightly sing to it to keep myself calm and focused. I find again that music is a very good tool for myself to calm down, to bring myself back into the realm of life when I'm off in my own personal world. It brings me back to the current reality. I started carrying my own insurance card again, possibly around the ages of 16 to 18, and it has everything required for medical emergencies, like let's say a minor car crash and I was unconscious and a Good Samaritan was coming by and they saw. They could easily fish into my wallet and pull out my ID and my medical insurance card to understand, okay, this is what this person has and this is their current medical personnel that I can contact. So they can do so, and the ambulance would instantly also, with my medical insurance card, understand that he has such and such medical insurance, so we should contact them to help foot part of the medical bill. I keep my emergency contacts currently in my cell phone, but I am also leaning towards getting a note card with them as well, so I can have one either in my wallet or in my glove compartment of my car and everything. Figure out how to set up your appointments with your parents' help. And if you are living alone, find a trusted friend or a colleague at your place of work. If they understand your disability and you have disclosed to them, explain to them why setting up these appointments are hard for you. See if they can help you understand my chart. See if there are other people in your lives that can help. And if you are currently seeing a counselor for any of your disabilities, listen to them and talk to them. They are there to help. They are a stepping stone on your path through life. Don't ignore the small little pebbles that they are. Pick them up and carry them with you. Even if you do drop them on later in life, they will always be a part of it. Never lose them.
It's always better to work as a team than work individually when it comes to your mental and physical health. It's why we have doctors and therapists, dietitians, surgeons, pediatricians. They are needed parts of our world as much as parents are. Don't go it alone. Find people who will help you.
Overall, my only suggestions to everybody is take your time.